Hello everyone, this is your Potesh Kotari. Welcome to my YouTube channel. So in this video, I'm going to cover Viva related to M.Phil course in Central University of Psychiatry, Ranchi. So now I'm pursuing my PhD in nimhans. I completed my M.Phil from Central University of Psychiatry, Ranchi in PSW department in 2023. So this video just I'm giving my own experience, what are the questions I have faced, and I asked my some fellows and some juniors as well what are the questions they got. So this video is just for information, and you might get some questions from this in this video, or you might not get any questions from this video, but definitely it will make you aware about the interview pattern. There will be all department faculties will be there, head of the departments faculties will be there. So like psychiatric social work PSW department head will be there, and clinical psychology head will be there, and director research will be there, and the remaining some faculties will be there, around 5 to 6 people will be there. So then the interview will start to like introducing yourself. You give your introductions very well and practice it, and watch some videos in introduction, what and all the important things we can cover. If you're having any work experience, so you'll tell your work experience. Based on that, they'll give some they'll ask some questions related to your work experience and how that work experience relates to your psychiatry social work department or your course related. So they will ask those things, like always it happens like how we are giving answers. Based on our answers only they'll make some make next questions. In this interview they won't ask you like very deep, so they'll check whether you are having theoretical knowledge or not. You are already clear the examination, you are already you're already having passion and interest to do one field, and apart from they'll check your some theoretical knowledge. So that's why this interview. Okay, so start with introduction and explain your work experience very well and how it's related to your field. And now you have to read your social work PG syllabus entirely. So mostly they'll ask PG syllabus questions only, because in interventions and therapies, all those things you will learn after joining M.Phil. So therapy and all those things they won't ask you, but they might ask you very brief interventions related, some psychoeducation, all those things they might ask you. But for me, they didn't ask any questions on those things. So basic questions they asked me, like definition of social work and what is the difference between therapy and counseling, and who is the father of social work, and some authors books in social work books, like who gave social casework book, social diagnosis, Mary Richmond. No, so you read about that Mary Richmond, and Mary Richmond and Freud, all those things, Sigmund Freud, and you read about these books and their history. They might ask some questions to you. Come to our social work. So definition of social work and principles of social work, and definition of psychiatric social work and definition of psychiatric social work, and principles of psychiatric social work and methods of social work. So these questions, and you have to be very thoroughly and point to a step by step. The principles of 7 principles are there, no? So those 7 principles you learn step by step. Okay. Then read about that methods of social work, case work, group work, community organization, research and social action and welfare and administration. Go through this all these methods, and read about any recent schemes related for well-being programs of mental health related schemes, and read about like in Ranchi, Jharkhand, how much pension they are giving, like if they get disability certificates, how much benefit they will get, what are the schemes are there in Jharkhand district, and central level and state level schemes you read. Okay. Then in CIP you have your role is like they might ask what under roles and responsibilities after joining your M.Phil. So we have to do our clinical work, like you have to see your patients in your PD, and you have to take psychosocial psychotherapy, and your academics will be there, you have to attend your academics, and your research work will be there. Okay, clinical work and psychosocial interventions and academic and research. So you have to complete your dissertation, you have to be submitting this within the 2 years. So you have to be have knowledge in psychiatry, like schizophrenia, depression, OCD, and autism, substance, all those things in this symptoms and diagnosis criteria. Read about all those things, and psychosocial interventions, they won't ask you yet currently, because after joining only you will read about the intervention and you will get a training in the interventions. And some theories they might ask you: social learning theories and hierarchy, Maslow's hierarchy theory, and psychosexual developmental theories, and cognitive developmental theories, and learning theories. So all the social work theories, whatever the related social work theories are there, you go through those theories and read about that group work and group work principles and methods and case work principles and methods, all those things you clearly read about those things. Then in if you want to understand that the nature of working of CIP and how CIP is providing a psychosocial support to the patients. Okay, CIP is strictly following a multidisciplinary team. There will be a psychiatrist, like who are completing their MBBS, and after that they are joining MD, or there is like a PG, their PG qualification. Then there will be a clinical psychologist, your colleagues, and after they are also joining, like same after their post graduation they are joining for their MPhil. We are joining after our MHW, they are joining after their post graduation. Then psychiatric nursing will be there, and we are psychiatric social worker will be there. This is the major four departments will be there. Apart from that, so multidisciplinary team, so they might ask you like what is a multidisciplinary team and how it's playing a role in the mental health institute. So multidisciplinary team who and all there, like a psychiatrist will be there, clinical psychologist will be there, psychiatric social worker will be there, and psychiatric nursing will be there, occupation therapist, music therapist, and physiotherapists and dietitian. So these members will be there. So how to go through this multidisciplinary team, and if you search on the articles, you will get in online. Then you will get information and thoroughly go through that and explain that how it will be helpful, why we need to follow this multidisciplinary team. Okay. So this thing is happen, and then you have to see the cases. So pretty clinical cases you have to be, so go through some schizophrenia symptoms and diagnosis criteria, and bipolar disorder and bipolar symptoms and diagnosis criteria, and substance disorders, and if you come to the child, autism, conduct disorder, ADHD, so these things, and if elder people, dementia will be there, Alzheimer's. So go through these disorders, and so interpersonal conflicts, so and disabilities assessment. So what are the disability assessment, what are the skills you can use. So this is like in-depth disability assessment, all those things will be in-depth. They might not ask these questions, but basic questions they will ask. Okay, definition of social work, definition of PSW, history of PSW, they ask you some theories. So that's why you go through your PG syllabus. So the entire PG syllabus, if you cover, no, so definitely you will give answers. And recently, any changes in mental health act, and go through the new education policy, what are the changes are came, and go to some RPWD acts and all those things. These things might be help you. Okay. So be confident. So whatever you are saying, so be give answers with the full confidence. If you're doing wrong also, there is no issue. Apart from this, they might ask you related to your English, Hindi language. Like you, if you are going from Telangana and Kerala or Andhra Pradesh, so you might not have that fluent in Hindi language. No? So they will ask you what are the challenges you are going to face. So you say, so I don't think so, sir, there are any challenges. So I have completed this my education and having this experience. I'm capable to do my duties. They might you ask whether do you know Hindi language. So then if you don't know also, you tell them yes sir, I knew it, but in the fluent I don't know that much fluent, but I knew it and I'll understand. So I'm working on that and learning Hindi language. I learned it, sir. So there is no problem. Okay, you have to give the answer. Okay. So be confident, and the interview will be around 10 to 15 minutes mostly, and sometimes it will be extend the time. Okay, sometimes like 30 minutes like that they might take. It will start around 10 o'clock to till 7 o'clock also they might take. So there is no like exact time. So if you are planning to return in that day only, so book your trains and flights and buses the last after 10 o'clock or 11 o'clock like that, last train, last bus, you book it. Okay, so all the best guys, and still if you're having any doubts, and please do comment on my YouTube in this video.